name is Dr. J.C. Smith, and I'm a chiropractor in Warner Robins. Today I'd like to discuss the upcoming healthcare reform and how chiropractic care can reduce costs and improve outcomes in the back pain industry. My previous show focused on the recent scientific research that spoke of the new guidelines that recommended spinal manipulation for acute and chronic low back pain. Experts from the United States, England, Denmark, Norway, Sweden, Canada, Australia have all compared the many treatments used for back pain and all have recommended chiropractic spinal manipulation as a proven treatment that should be used first in most cases before drugs, shots, or surgery. The Back Letter, a professional journal for back care physicians, recently reported the popularity of spinal manipulation for acute back pain. Quote, numerous international guidelines have endorsed the use of spinal manipulation as a treatment for acute back pain as part of an evidence-based treatment program. While the rising healthcare costs, these experts and medical economists also urge a change in treatment from drug, shots, and surgeries to natural conservative methods like chiropractic care that could save billions of dollars and improve outcomes for the millions of Americans who suffer from back pain. According to the Obama White House spokesman, quote, the path of fiscal responsibility must run directly through healthcare, and efforts to limit healthcare costs as a single most important thing we can do for long-term fiscal stability. President Obama said, putting America on a sustainable fiscal course will require addressing healthcare, adding, many of you said what I believe, that the biggest source of our deficits is the rising costs of healthcare. Although reducing healthcare costs sounds good to patients, there are many health professionals who cringe at the thought of this, especially those in the spine surgery business. Indeed, any healthcare reform success will have to overcome the greed of many surgeons, hospitals, drug companies, and HMOs who are now profiting greatly in this present for-profit system, despite the emerging fact that Americans are not getting much bang for this huge buck we're paying. A new study by Brooke Martin, MD, of the University of Washington offers a less than flattering portrait of spine care in the United States, an image that mass media has transmitted around the world. Just listen to these international headlines. Back pain empties patients' wallets in the United States, trumpeted a headline in Pravda in Russia. Throwing money at back pain treatments does not guarantee relief, according to newsmedical.net in Australia. Back pain up, relief down, noted an article in the Washington Post. Back pain, no gain, observed a poetic headline at Forbes. And a feature at Newsweek asked whether Americans are simply throwing their money away. A new study reveals that Americans are spending record amounts on treatments for their back pain, but are these expenses fixes a waste of time? According to the editors of the Back Letter, a professional medical journal, over the last decade, the United States has pursued an increasingly aggressive treatment of spinal problems. The past decade has seen aggressive use of diagnostic testing with MRIs and other forms of advanced imaging. There has been a rapid increase in the use of unproven narcotic therapies for the long-term treatment of chronic back pain and neck pain. The editors continue to say that there has been spiraling use of spinal injections that find scant support in the scientific literature. And the rate of surgical procedures proven and unproven continues to climb. The editors also commented that a never-ending flow of advertisements and articles in the mass media has fueled this explosion with promises of easy fixes, miracle cures, and freedom from pain. Of course, this is merely hyperbole that is unproven, as Dr. Martin's study indicated. Martin found that costs are soaring to $100 billion annually in the U.S., but that outcomes aren't following suit. Nationally, the annual expenditures attributed to spine problems rose 65% from 1997 to 2005. During this period, the health status of those with spine problems did not improve, said lead author Martin recently. And in terms of self-reported physical limitations, some outcomes actually worsened. We did not observe improvements in health outcomes that are commensurate with the increasing costs over time. This suggests we are not getting sufficient value for the money we are investing in the treatment of patients with spine problems, Martin added. I dare say we all have family or friends that have had a spine surgery, and for the most part, they are no better off. In fact, while some may get temporary relief, in the long run, many are worse than after the spine fusion, and the researchers now agree. I think the truth is we perhaps oversold what we have to offer, commented co-author Richard Deo, a medical doctor from Oregon Health and Science University. All the imaging we do, all the drug treatments, all the injections, all the operations have benefit for some, but in each of these situations we've begun using those tests and treatments more widely than science would really support, Deo suggested. He continues to criticize what he calls old concepts supported only by weak evidence, and is very critical of the reliance on MRI exams to convince patients that disc abnormalities are the cause of back pain, since most adults without any back pain also have spine arthritis of some sort. Detecting a herniated disc on an imaging test therefore only proves one thing conclusively: the patient has a herniated disc. And it certainly doesn't mean every herniated or degenerative disc requires surgery. 40% of patients over 40 years of age have disc abnormalities, but no back pain. He jokingly referred to these as incidentalomas and likened them to finding gray hair as the cause of your back pain. In other words, a disc abnormality alone is not considered a reasonable cause of back pain, which explains the high failure rates of spine fusions. Deo's research found a huge increase in surgery for degenerative disc disease, although researchers agree that degenerative discs are commonplace among most adults. He found there were over 100,000 lumbar fusions for degenerative conditions in 2001. This represents an increase in fusions from 1990 to 2001 of 220%. Yes, you heard me right, an increase of 220%. The call for reform rings loudly from the editors of the Back Letter, a foremost journal in the world of spine care. Quote, "The world of spinal medicine, unfortunately, is producing patients with failed back surgery syndrome at an alarming rate. Despite a steady stream of technological innovations over the past 15 years, from pedicle screws to fusion cages to artificial discs, there is little evidence that patient outcomes have improved." The Back Letter also admits that neck surgery is just as inappropriate. Quote, "However, no form of cervical surgery has been proven to be superior to non-surgical care or waiting out the symptoms." I.P. Fuas, M.D., also questions the role of neck surgery when compared to non-surgical methods like spinal manipulation. There are no significant differences in results between people who receive surgery compared to those who had non-surgical treatments. It is not clear whether the short-term risks of surgery are offset by any long-term benefits. Not only is neck surgery questionable, but epidural steroid injections were also suspect to the researchers who found no benefit for steroid injections in the treatment of patients with neck pain after motor vehicle accidents. According to Stephen Sanders, Ph.D., nerve blocks for neck pain are not supported by scientific research. From the current review, we must conclude injections and blocks produce a large amount of money with very little science to support their application, he said. And the role of drugs for neck or back pain is also unfounded. According to Dr. S.K. Maraza, among those patients who've had a neck or back surgery, most admit they are still using narcotics for pain control. Even among the patients classified as having a successful result, most were still using narcotic medications at the 2-year follow-up, including 64% of the successful result patients in the disc replacement group and 84% in the fusion group. Needless to say, this call for reform by the federal agency and international experts has fallen on deaf ears for the most part in America due to the huge monies involved. In fact, surgeons and hospitals are making money hand over fist from back surgeries as they are from heart surgeries. The direct and indirect costs of back pain approach $100 billion annually in America. Over 1 million inpatient spinal surgeries in the U.S. alone. The direct costs are astronomical and may reach for a lumbar fusion as high as $169,000. Lumbar laminectomy, $82,000. Cervical laminectomy, $60,000. And cervical fusion, over $112,000. Is there any wonder why there is an international call for reform? And is there any doubt why the medical profession opposes this reform when you consider the huge money at stake? Dr. Richard Deo also calls for reform. Quote, "People say, I'm not going to put up with it and we in the medical profession have turned to ever more aggressive narcotic medication and more invasive surgery. More people are interested in getting on the gravy train than on stopping the gravy train, he said. And there are many doctors who want to drive the gravy train even faster, despite the overwhelming evidence that conservative care for back pain is more clinically and cost-effective than the short-term methods of drugs, shots, and surgery. The most startling comment I've read from the medical researchers regarding the epidemic of back pain and the failure of back surgery came from Dr. Gordon Waddell, orthopedic surgeon and author of the book, The Back Pain Revolution. Quote, "Low back pain has been a 20th century healthcare disaster. Back surgery has been accused of leaving more tragic human wreckage in its wake than any other operation in history." Unquote. Dr. Waddell also recommends chiropractic care for this epidemic of back pain. There is now considerable evidence that manipulation can be an effective method of providing symptomatic relief from some patients with acute low back pain. Despite the international call for reform in the management of back pain, little has changed, especially in Middle Georgia. And it does get more confusing for the average patient to know what works best. Today, back pain care is like a supermarket with over 200 treatments, and often patients seek advice from many medical doctors who, frankly, are not well educated in this area, according to Dr. Deo, who published an article in Scientific American in which he mentions the fact that most primary care providers are not well trained in musculoskeletal problems. Quote, "Calling a physician a back pain expert, therefore, is perhaps faint praise. Medicine has at best a limited understanding of the condition. In fact, medicine's reliance on outdated ideas may have actually contributed to the problem," he said. According to research presented at the annual meeting of the North American Spine Society by Dr. Paul Bishop, he agrees that many problems arise with primary care physicians who manage back pain patients with ineffective treatments. Typically, the family physician-based care involved excessive use of passive therapy such as massage and passive physical therapy, excessive bed rest, and excessive use of narcotic analgesics. Dr. Deo admits that medical care for the epidemic of low back pain is simply stuck in its thinking by using narcotic pain pills, steroid injections, MRIs, and spine surgery when the research cannot support this model of care. I'm not sure we've made much real progress in the effectiveness of clinical care. We seem stuck in conventional models that haven't worked very well so far, he admitted. And stuck they are, perhaps more frozen in time when it comes to back pain care. According to the National Academy of Sciences, it takes an entire generation of 17 years for new technology to become mainstream. In the current healthcare system, scientific knowledge about best care is not applied systematically or expeditiously to clinical practice. An average of about 17 years is required for new knowledge generated by randomized controlled trials to be incorporated into practice, and even then, application is highly uneven. I might add, with the medical prejudice against chiropractors, it takes even longer for MDs to admit that spinal manipulation is a proven treatment for back pain, despite the overwhelming evidence. Indeed, after years of demonizing chiropractors, it must stick in their craw to admit that spinal manipulation is a proven treatment. And it must be hard for them to admit their training in musculoskeletal disorders is woefully inadequate. Not only are most MDs poorly trained in these back pain problems, many mistakenly assume back surgeries are typically successful. If your MD doesn't warn you about the side effects of drugs, shots, and surgery, and if he doesn't inform you that spinal manipulation is a proven treatment, then he hasn't been totally honest with you. For example, according to a study done by Dr. E. Berger, 1,000 workers' compensation patients who had undergone lumbar spinal surgery were divided into two groups. One group consisted of 600 patients with single operations, and the second group consisted of 400 with multiple operations. The results were stunning, to say the least. 71% of the single operation group had not returned to work after more than 4 years after the operation, and 95% of the multiple operations had not returned to work. In none of these cases was there a neurological deficit that precluded gainful employment. the failure to return to work was blamed on chronic post-operative pain. Dr. Deo admits that some surgeons estimate about less than half the spinal fusions being performed were appropriate. Imagine the money that would be saved if these surgical patients were referred first to chiropractors, as the guidelines suggest. Even the American College of Physicians and the American Pain Society now agree that for acute and chronic back pain, spinal manipulation is recommended. Dr. Deo also mentions chiropractic as a possible solution. Quote, "Chiropractic is the most common choice, and evidence accumulates that spinal manipulation may indeed be an effective short-term pain remedy for patients with recent back problems." Since many chronic cases have periodic relapse, new evidence also shows that preventative maintenance chiropractic care reduces the number of relapses and their intensity. It also shows the positive effects of preventative chiropractic treatment in maintaining functional capacities and reducing the number of intensity of pain episodes after an acute phase of treatment. Dr. Aj Indal, MD, summarized the present dilemma in spine care when he said, "Many of our ideas about low back pain have been wrong. The slow pace of change in giving up old ideas is probably a result of the lack of new ideas." Indeed, "Don't confuse me with the facts or new ideas" seems to characterize the present state of affairs for some physicians and surgeons. And it's not as if the researchers aren't trying to change the medical culture that has oversold the value of drug shots and spine surgery. The problem isn't the lack of science anymore. The real problem is there's too much money involved to stop this tsunami of drugs, shots, and surgery. A prime example of this contempt for new ideas came after the landmark 1994 U.S. Public Health Service Agency for Healthcare Policy and Research did an extensive 2-year study on acute low back pain that recommended spinal manipulation as a proven method. This was the most extensive analysis of back pain at the time, a 2-year study of over 4,000 scientific articles, and it shocked the medical profession when spinal manipulation, the mainstay used by chiropractors, was proclaimed by the U.S. Public Health Service Agency as a proven method and the preferred initial professional treatment of acute low back pain. This guideline states, quote, "This treatment, using the hands to apply force to the back to adjust the spine, can be helpful for some people in the first month of low back symptoms, and it should only be done by a professional with experience in manipulation." Of course, chiropractors are primarily the professionals with experience in manipulation, since we do 94% of all manipulation done in the United States, according to a RAND study. The other 6% of spinal manipulation is done by some PTs, a rare osteopath, and a few MDs called physiatrists, but without question, chiropractors are the masters of this healing art. Indeed, if it weren't for the tenacity of chiropractors, this would be a lost art today. Not only did this recommendation of spinal manipulation shock the medical profession, but another shocking conclusion in the U.S. federal guideline warned patients about the low success rate of back surgeries. Quote, "Even having a lot of back pain does not by itself mean you need surgery. Surgery has been found to be helpful in only 1 in 100 cases of low back problems. In some people," it said, "surgery can even cause more problems. This is especially true if your only symptom is back pain." This federal guideline also warns of the complication rate of back fusions in particular. Quote, "Surgery increases the chance of future procedures with higher complication rates. There appears to be no good evidence from controlled trials that spinal fusion alone is effective for treatment of any type of acute low back problems in the absence of spinal fracture or dislocations. Moreover," it said, "there is no good evidence that patients who undergo fusion will return to their prior functional level." This honest evaluation of spinal fusion shocked and angered the medical profession, despite the fact that this was the most authoritative group of investigators that was headed by orthopedists themselves. After the release of this federal guideline in December of 1994, the North American Spine Society successfully lobbied Congress to revoke the ability of the Agency on Healthcare Policy and Research to do its job mandated by Congress to investigate medical procedures and to recommend treatment guidelines with the goal to lower costs and improve outcomes. Its ire stemmed from the criticism levied at spinal fusions, especially those involving pedicle screws, due to the findings that fusions had few scientific validated indications and was associated with higher costs and complications rates than other types of back surgery. As a member of this panel, Dr. Richard Deo subsequently co-authored in the New England Journal of Medicine an article in response to this intimidation called "The Messenger Under Attack: Intimidation of Researchers by Special Interest Groups." He alluded that the for-profit mindset of some surgeons supersedes the value of research. Quote, "The huge financial implications of many research studies invite vigorous attack. Intimidation of investigators and funding agencies by powerful constituencies may inhibit important research on health risks and rational approaches to cost-effective health care." Is it any wonder why the AMA didn't like this report, since it was painfully honest about the poor results from spine surgery, especially fusions? In fact, the Spine Surgeon Society sued to keep this report from first being released, but a federal court intervened to release it in December of 1994. After this landmark study, other countries began to study the back pain business and came to the same shocking conclusions that drugs, shots, and surgeries had no long-term advantage over conservative treatments like chiropractic care and active rehab exercises. Not only are back surgeries risky, the high rates of back surgery suggest either Americans have an especially bad backs or American surgeons are out of control. According to Dr. Deo, quote, "The rate of back surgery in the United States was at least 40% higher than any other country and was more than 5 times those in England and Scotland. Back surgery rates increased almost linearly with the per capita supply of orthopedic and neurosurgeons in the country," he said. This may explain why Macon is the back surgery capital of Georgia, since it has so many spine surgeons. Not only are spine surgeries often unnecessary, patients are rarely told beforehand that there may be poor outcomes, such as 80,000 new cases of failed back surgeries per year in the United States, 19% reoperation rate, that 71 to 95% of lumbar fusion patients will never return to work, and also that according to Dr. Lynn Johnson, director of the Center for Pain Evidence of North Carolina, while back surgery has a place, there are too many surgeries being done, and that most doctors fail to apply conservative measures such as chiropractic, physical therapy, and minimally invasive techniques before suggesting surgery. Just about any approach is better than having surgery, because all the studies have shown that if you take a surgical population and non-surgical population, they all seem to do the same in 5 years. Even Timothy Johnson of ABC's World News shocked the spine surgeons when he broadcast in May of 2006, quote, "So why are so many back surgeries performed in this country? It could be a combination of too many surgeons who are too eager to operate and the impatience of many patients who want results quickly. The truth is," he said, "that 90% of back pain can be resolved without surgery if both doctors and patients are willing to try other treatments that basically help the back to heal itself." I might add, experts now agree that chiropractic care is the foremost among other treatments that Dr. Johnson suggests. Again, let me quote Dr. Anthony Rosner, PhD, when he testified before the Institute of Medicine. "Today we can argue that chiropractic care, at least for back pain, appears to have vaulted from last to first place as a treatment option." The call for reform in healthcare treatments is not new. As far back as March 2001, the Institute of Medicine, a part of the National Academy of Sciences, a private organization chartered by Congress to advise government on scientific matters, released its report, "Crossing the Quality Chasm, a New Health System for the 21st Century." Despite the major advances in medical research and disease treatment, the American healthcare system is failing to improve the care of patients, according to their experts. This report also states that most troubling is that proven methods that can lower costs and improve patient outcomes are not being used in everyday practice, such as chiropractic care for the epidemic of back pain. We now know that superficial makeovers will not suffice, admits the Institute of Medicine, indicating that entirely new patterns of thinking will be necessary to escape this dilemma. Indeed, it's time to think out of the medical box of drugs, shots, and surgery for back pain. As you've seen, the international and American experts agree that these medical methods have only made matters worse, and all suggest conservative care like chiropractic before resorting to risky, expensive, and often ineffective drugs, shots, and spine surgery. Quote, our present efforts resemble a team of engineers trying to break the sound barrier by tinkering with a Model T Ford. We need a new vehicle, or perhaps many new vehicles. The only unacceptable alternative is not to change, suggested Mark Chasson. Certainly, to solve this epidemic of back and neck pain, we need fewer drugs, shots, and surgery, not more of the same aggressive methods that have proven so ineffective and expensive. If you're suffering with low back or neck pain, and if your family doctor has not referred you to a chiropractor, and you're living on pain pills, muscle relaxants, contemplating epidural shots or surgery, then I can honestly suggest you might change doctors and find one who follows the guidelines and recommendations of these experts. After all, it's your body and your suffering that we're talking about. I understand that these facts, recommendations, and warnings by medical experts may shock you, especially if you've already had a spine surgery. Rarely are people told the truth about the risky and costly nature of spine surgery, nor are they told the cold facts about the failure of pain pills and epidural shots. In Middle Georgia, it just continues with old concepts supported by weak evidence, as Dr. Deo mentioned. If you want to learn more about my office, log on to smithspinalcare.com to see the new scientific findings and learn more about how we can help you overcome your back pain. And if you're ready to act, if you're ready to try a proven method for your back pain, phone my office for an appointment at 922-4091. And if I can help you, I promise to refer you to someone else for a second opinion. By all means, give chiropractic care a try before drugs, shots, or surgery. I'm Dr. J.C. Smith, and thanks for watching.